GERD is acid reflux. GERD stands for gastroesophageal reflux disease, and it is a condition where there is a weakened sphincter at the lower edge of the esophagus, so that the gastric contents are able to reflux up into the esophagus. There are a lot of different symptoms from it. Heartburn is probably the most common, which is a burning in the esophagus. It will cause pain in the chest. It can also reflux up so that it bathes the vocal cords. It can cause hoarseness, it can cause cough, it can cause aspiration where the fluid actually goes back up into the back of the throat. The biggest danger is that the esophagus is constantly being bathed in acid, which causes a chronic burn. This has the potential to develop what's called Barrett's esophagus, and this has a 40 times greater incidence of development of esophageal cancer. But we know that in the United States alone, there are at least 60 million people that have gastroesophageal reflux disease. Of those, there are approximately 21 million that are taking some type of proton pump inhibitor over the counter or sometimes by prescription to help diminish the acid. Of these, at least 38% still are having symptoms. The goals of surgery are to increase the strength of the lower esophageal sphincter, and that's what it is keyed toward. The other part of surgery is to repair a hiatal hernia defect if a hiatal hernia is present. We have a couple of ways that are very effective. The traditional way is a fundoplication. In the fundoplication, the fundus, or the upper part of the stomach, is mobilized so that it can be wrapped around the lower part of the esophagus. The newest modality that we have that's very effective and I'm very excited about is the magnetic sphincter augmentation device. In this procedure, we take a string of magnets and we put them around the esophagus at the lower portion. They augment or increase the efficacy, the functioning of that lower esophageal sphincter. There's been a lot of excitement recently because we're seeing very good resolution of Barrett's esophagus. We're seeing resolution of the burn injury to the esophagus with this magnetic sphincter augmentation device. It's done laparoscopically. It generally takes about 30 minutes, and the majority of patients are home in less than 24 hours. Many patients go home that day.